Beat with Dr. Vanita Zahn.
And welcome. Star Trek fans are familiar with the handheld scanner used by Doc of Bones when we're well on our way to something like that. It's called the Vscan Air, and Dr. Kyle Leonard from Hudson Headwaters Health Network has used it, and he is with us now to talk about it. Hi, Doc. How are you?
I'm doing well. Thanks for having me.
This is very Star Trek. It's a wireless pocket-sized ultrasound that I guess gives you great image of the whole body you can scan. Talk to us a little bit about why you would use it, on who.
So, yeah, I love the analogy of Star Trek because it is definitely a bit like stepping in the future. The applications of this device are basically limitless. I use it several times a day. I did happen to notice you do have the splint on there on the wrist, and there's one example. Someone comes in with wrist pain. I can take the ultrasound, and here's one of the ultrasound devices, quite small. I can take the ultrasound device, put it on the wrist. I can see the carpal tunnel. I can look at the nerves in the wrist, the muscles, the tendons in the wrist, show you exactly what I'm seeing real time. It's a bit like actually looking into the body, as opposed to, if you brought your car to the mechanic and they didn't even pop the hood and just listened to it and said, yeah, this could be what's wrong. I feel like that's what I was doing before having this device in my hands. If someone comes in with stomach pain, I can look at the gallbladder, I can look at their heart, if they have any chest discomfort. I mean, it's pretty amazing.
But it's soft tissue, and just for the record, the dog and we crossed our paths, and I went down awkwardly, and so this became looking at the bones. Can you, so this was an X-ray. Does the device do that, or is it strictly ultrasound technology in a sense and looking at soft tissue?
So ultrasound technology historically has looked at soft tissue. There are some applications looking at bony structures. It's a screening device. So I had a 3-year-old who had an unfortunate a trampoline incident, and they had some tenderness, and I put the ultrasound on, and I can actually see some bony disruption with ultrasound. So we sent him for X-ray, and sure enough, it confirmed the fracture, but it can give us insights into the bones as well.
I know this is in partnership with GE. What does a unit like this cost? So the question then becomes, is this effective? Is it appropriate? Is it, can people afford, can practices afford it?
Yes, that's an excellent question. Historically, the bigger machine units could run around $40,000 or more. Even the laptop units, you're looking at tens of thousands of dollars. The smaller handheld units are in the ballpark of from $1,000 to $5,000, and $5,000 is very affordable for many practices, especially with how often we end up using this during the course of a day. Yeah,
now I know we've got some video that we can take a look at as we continue our conversation. And here, there you go. You seeing it. I love all the docs, the fake doctors involved in this video. And it marries with the cell phone, and that's where you see your images.
Correct. You see them on your own personal device. And I love the image of the doctor just putting it right in his scrub top, because it easily can be carried around in your pocket. It's lightweight, and it's the closest thing to a tricorder that we have right now.
And I'm wondering, women who are pregnant go in and they routinely are having ultrasounds done of their developing baby. Is this applicable in that case as well?
Now, the quality of the images is very, very high quality. We'd still recommend what we call the full formal ultrasound for pregnant women. But, I can see some basic fetal anatomy with this of the baby. We can look at the baby's heart, which is really special to see the heart beating right on the screen. And you can definitely use it in OBGYN as well.
I know there are a lot of folks who are longing for the day when a PET scan is not that expensive. You can go and get a full body scan and see, heaven forbid, if there's something percolating that you can find early and treat. Is this the forerunner to that?
Well, this really does open a lot of possibilities to see inside of someone's body right in the exam room. I can't say whether the future is going to be being able to scan someone head to toe right in the office, but this opens up new windows inside of your body, which we didn't have previously.
And before I let you go, how many of your practices, the HHN practices, are utilizing this device?
Mm-hmm. So we have at least 5 of these devices employed now through the network. We're using them in urgent care. We're using them in the office, and there's been hundreds of scans done right in the office to date. They've also been used in medical education as well, when teaching future physicians anatomy and pathology, to be able to show them real pathology for a patient in front of them by showing the muscles, by showing the thyroid, the liver. It's invaluable. I
can just tell by the smile on your face how much you are enjoying having this as a tool to help you with your patients. Dr. Kyle Leonard at Hudson Headwaters Health Network, thanks so much. What a neat thing. And thank you for spending time with us. If you've got a topic you'd like covered, drop me a note at bzon@wnyt.com. Till next time, be well.